Have you ever stopped to wonder what truly runs through your doctor's mind when you step into their office? Most of us assume that a warm smile and professional voice reflect complete understanding, but beneath the surface, unspoken assumptions often exist. And when it comes to older adults, these quiet beliefs can quietly shape the care you receive. They influence how seriously your symptoms are taken, which treatments are offered, and even whether life-changing options are explained to you. In this video, we are going to uncover 5 unsettling truths about how some doctors actually view seniors. But don't worry, knowing these truths is the first step to gaining the attention and respect you fully deserve in every appointment. Stay until the end, because the final truth could completely shift the way you approach your next visit. If you're with me, comment the number 1 below. Like this video, subscribe, and turn on the bell for more inspiring content. Number 1, they often assume most symptoms are just old age. For many older adults, this is one of the most discouraging realities in medical care. You walk into the office describing pain in your knees, unusual tiredness, or small changes in your memory, and instead of a deeper look, you hear something like, "That's just part of getting older." On the surface, it may sound harmless, but this attitude can have very serious consequences. Yes, aging naturally brings changes, but assuming every complaint is the inevitable result of age can mean dangerous conditions are overlooked. Once a symptom is dismissed as just old age, the sense of urgency to investigate further often disappears. A person who mentions shortness of breath may be told it is a normal slowdown, when in fact, it could be an early sign of heart disease. Occasional forgetfulness might be brushed aside as nothing more than a senior moment, even though it could point to a thyroid imbalance, medication side effect, or another treatable issue. The real danger here is not only in the missed diagnoses, but in the lost opportunities for prevention and recovery. When doctors stop looking, patients lose the chance to catch early problems that could have been corrected or managed successfully. This kind of mindset does not always come from cruelty. Often, it is a result of pressure. Doctors are expected to see many patients in a short amount of time. When they hear a familiar complaint from an older adult, it can be tempting to jump to the simplest explanation rather than asking more questions or ordering additional tests. But as every senior deserves to know, the simplest answer is not always the correct one. Treatable conditions like depression, nutritional deficiencies, or even early-stage cancers have been missed this way, leaving older people to suffer far longer than necessary. I remember the story of Harold, a 79-year-old man who began to feel constant fatigue and occasional dizziness. His physician reassured him it was nothing unusual, just the body slowing down with age, and advised him to rest more. Harold trusted his doctor at first, but as the weeks went on, his symptoms worsened. Finally, after urging for more tests, the truth came out: he had a heart valve problem that could be surgically corrected. After treatment, his energy returned, and he later said he wished someone had taken his concerns seriously from the beginning. Harold's story is a reminder that aging is not a blanket explanation for every ache, pain, or change in your health. Yes, your body changes over the years, but those changes deserve careful attention, not dismissal. A lingering cough, sudden weight loss, or unexpected difficulty with movement are all signals that demand a thorough evaluation, no matter your age. This is why seniors must speak up during appointments. Do not accept quick reassurances like, "That's normal at your age." Ask questions. Request explanations. Insist on clarity. Your health at 80 is just as valuable as your health at 40. And you deserve the same diligence and effort that would be given to a younger patient. The truth is simple: being older does not make your concerns less real. Every symptom is worth investigating. And every patient, no matter their age, deserves the chance to live with vitality, dignity, and peace of mind. Number 2, they may believe older patients are less likely to follow treatment plans. There is another hidden belief that quietly influences the way some physicians approach senior care. It is the idea that older adults are less likely or even unable to stick to a treatment plan as carefully as younger patients. This assumption may not always be spoken out loud, but it can shape the care you receive in significant ways. Where does this mindset come from? It often grows out of a mix of stereotypes, past experiences, and unconscious bias. A doctor who assumes you will struggle to manage instructions may try to simplify things too much. Instead of explaining the full range of options, they might offer only the most basic plan. In other cases, they may avoid mentioning more advanced treatments entirely, believing you will find them too confusing or too difficult to manage. While the intention might be to make life easier, the result is that you walk away with less thorough care than you deserve. This belief is often tied to concerns about memory loss, hearing challenges, or difficulty juggling multiple medications. Some physicians may think, if I provide too many details, they will forget. If I prescribe something complex, it will be overwhelming. Of course, there are older adults who face these challenges, but it is a mistake to assume this applies to everyone. Many people in their 70s and 80s are perfectly capable of following detailed instructions, setting reminders, and even researching their own conditions to make informed choices. When doctors withhold information based on assumptions, they take away your opportunity to choose what is truly best for your health. For example, a specialist might avoid discussing a cutting-edge therapy for arthritis because they assume you would not want the extra steps, or they may downplay how lifestyle adjustments like nutrition changes or structured exercise could work together with medication to control blood pressure. Without the full picture, you are left unable to decide which path offers you the best chance for a healthier life. I recall the story of Margaret, a 76-year-old woman who was diagnosed with a heart condition. Her first cardiologist offered her a very basic plan, believing she would not want anything too demanding, but Margaret wanted to take control of her health. She switched doctors, and her new physician approached her differently. He laid out every option, combinations of medications, specific dietary strategies, and tailored exercise routines. With that knowledge, Margaret created a plan that suited her lifestyle, and her health improved dramatically. What changed? Not her age, but the doctor's willingness to treat her as an engaged, capable partner. This is why it is so important to show your doctor that you are ready to play an active role in your care. Bring a notebook to appointments. Ask for written instructions, and do not hesitate to raise questions if something is unclear. These simple actions signal to your physician that you are serious about following through. When they see that commitment, they are more likely to share every option available, trusting that you can handle it. The truth is that following a treatment plan is not about age. It is about willingness, support, and clear communication. When you demonstrate that you are committed, you push back against the stereotype that older patients cannot manage their care. And when that barrier is broken, you are far more likely to receive the thorough, detailed medical guidance you truly deserve. If you are still here watching, let me know by commenting the number 2 below. And if you have not already, please like this video, subscribe, and turn on the notification bell so you never miss the valuable insights we share. Number 3, they may prioritize younger patients in certain situations. It is not easy to hear, but in certain medical settings, older patients do not always receive the same level of urgency or attention as younger individuals. This bias is rarely intentional, yet it can quietly shape decisions about who receives follow-up, testing, or even life-changing procedures. Why does this happen? Often, it stems from the belief that younger patients have more years ahead and therefore more to gain from aggressive treatment. In crowded hospitals and clinics, when time and resources are stretched thin, A doctor might instinctively devote more energy to a 30-year-old, assuming the benefits of intervention will extend further into the future. But this way of thinking overlooks an important truth. The value of quality of life does not diminish with age. A 75-year-old deserves just as much opportunity to live free from pain, remain independent, and enjoy daily activities as someone half their age. Prioritizing solely by birth year ignores the dignity and vitality that can still be nurtured at any stage of life. This kind of bias can show up in subtle but impactful ways. For example, an older adult complaining of chest discomfort might be told that additional tests are unnecessary because the symptoms are assumed to be part of normal aging. Meanwhile, a younger patient reporting the same issue could be scheduled for a full workup immediately. In other cases, surgical options are withheld, not because they would not help, but because the physician assumes recovery would be too difficult without even asking if the patient is willing to face the challenge. I think of Edward, an 80-year-old man who struggled with severe knee pain that limited his mobility. His first doctor quickly dismissed the idea of knee replacement surgery, insisting it was too risky for someone his age. But Edward was otherwise healthy, active, and determined to stay that way. Unsatisfied, he sought a second opinion. The new surgeon looked beyond the number of birthdays he had celebrated and instead evaluated his overall health and motivation. Edward underwent the surgery, recovered successfully, and soon returned to his cherished morning walks that had been impossible for years. His story illustrates why age should be only one factor in medical decisions, not the deciding factor. What matters equally is a person's current health status, mental outlook, and personal goals. A treatment that restores mobility or relieves chronic pain can have profound effects on independence and happiness, regardless of how many candles are on the birthday cake. That is why it is so important to communicate openly with your doctor. Share what you want from your care, whether it is to garden again, travel, or simply walk without pain. And if you feel your needs are being pushed aside in favor of younger patients, it is your right to ask questions or even seek another opinion. When you remind your healthcare providers that you value your time, your comfort, and your future, the conversation shifts from how long will you live to how well can you live. And that change can make all the difference in the quality of care you receive. Number 4, they may see your life goals as less important. Another subtle but powerful truth is that some physicians, often without realizing it, make assumptions about what really matters to older patients. They may believe that by the time you reach your 70s or 80s, your priorities have narrowed to nothing more than comfort and basic health maintenance. In their minds, the idea of pursuing new experiences, hobbies, or life goals fades away with age. This quiet assumption can influence the kind of guidance you receive. If a doctor believes you are simply trying to get by, they may overlook opportunities that could help you live more fully. A complaint about knee pain, for example, may lead only to a prescription for painkillers, rather than a discussion about physical therapy or surgical options that could restore mobility, or they may recommend the easiest, fastest solution, assuming you are no longer interested in putting in extra effort for greater long-term rewards. The reality, of course, is that many older adults continue to carry vivid, meaningful goals for their future. These goals matter deeply, even if they require energy and planning. To dismiss them is to dismiss a vital part of who you are. I think of Dorothy, a 78-year-old woman who dreamed of visiting her sister living overseas. Dorothy had lived with a chronic lung condition for years, and her first physician advised her to simply stay home and focus on being comfortable. But Dorothy longed for more than just comfort. She wanted to feel strong enough to make the journey. When she shared her dream with another doctor, the response was completely different. This physician designed a program tailored to her goal, a gradual exercise plan to build stamina, adjustments to her medications, and practical steps to prepare for air travel. 6 months later, Dorothy boarded a plane and reunited with her sister, describing it as one of the most joyful and meaningful experiences of her life. Her story shows us something essential. Your aspirations do not lose value with age. Whether it is gardening, joining a local club, writing a book, or traveling to see loved ones, your healthcare should be shaped to support those ambitions. If your doctor does not ask about your personal goals beyond basic health, speak up, share what matters most to you, and ask directly how your care can be aligned to help you reach those outcomes. When physicians see you not just as a patient to keep stable, but as a whole person with dreams, they are better able to design treatment plans that create real impact. And that impact goes beyond surviving. It is about living well. So remember, your goals are important at every stage of life. Do not hesitate to voice them. With the right support, you can live not only longer, but better. If you are still watching, comment the number 4 below, subscribe, and turn on the notification bell so you never miss future insights designed to inspire and empower you. Number 5, they may underestimate the emotional impact of aging on health. In many medical settings, doctors devote most of their attention to measurable physical issues, blood pressure, lab results, or joint pain, while giving far less consideration to emotional health. Yet for older adults, the emotional side of aging can be just as influential as the physical. Aging is not only about the body slowing down, it also involves adapting to loss, shifting roles, and sometimes reduced independence. When emotions are brushed aside, treatment plans can feel incomplete, leaving critical needs unmet. Too often, feelings such as sadness, anxiety, or withdrawal are dismissed as nothing more than just part of getting older. Important questions about loneliness, grief, or fear of the future are rarely asked because they do not appear on a standard medical checklist. But ignoring these concerns is a serious mistake. Emotional well-being has a direct impact on the body. Stress and sadness can disrupt sleep, reduce appetite, weaken the immune system, and slow recovery from illness. In other words, what happens in the mind shapes the body more than many realize. I think of Harold, a 79-year-old man who lost his wife after nearly 5 decades together. In the months following her passing, his health deteriorated quickly. Every doctor's visit focused on medication adjustments, new prescriptions, dosage changes, but none of the physicians asked how he was coping emotionally or whether he had support at home. Harold felt invisible. It was not until a neighbor encouraged him to seek counseling that things began to shift. Speaking about his grief gave Harold a sense of relief. And slowly, his physical health improved as well. His energy returned, his sleep stabilized, and he once again felt motivated to take part in daily life. What changed was not his medication, but the fact that someone finally acknowledged the emotional weight he had been carrying. The challenge is that emotional struggles are often hidden. Many older adults respond with, "I'm fine," when asked how they are doing, even when they are far from it. That is why it is so important to speak honestly with your doctor about feelings of loneliness, worry, or sadness. This is not complaining, it is giving your healthcare provider the full picture they need to treat you effectively. When emotional health is ignored, patients may feel unseen and unsupported, which can quietly undermine their physical recovery. But when it is addressed with care, the outcome can be remarkable. Better energy, stronger resilience, and a renewed sense of purpose. A compassionate doctor understands that caring for you as a whole person means treating both mind and body, and sometimes a single heartfelt conversation about your emotions can be as powerful as any prescription written on a pad. Final thoughts. Hearing these 5 hidden truths may stir a range of emotions. Some of you may be nodding in recognition because you have faced them yourself, while others might feel unsettled or even a little upset. That reaction is completely natural. But let me be clear, the purpose of this conversation is not to criticize every doctor or to create mistrust. Instead, it is meant to remind you of something essential. Your health and your dignity deserve to be fully acknowledged and respected, no matter your age. When you carry this awareness into your medical visits, you stand taller, ask sharper questions, and make sure your concerns are taken seriously. Growing older does not lessen your importance. In fact, the years you have lived bring wisdom, resilience, and perspective that no test result can measure. These qualities are a vital part of who you are, and they deserve to be honored within every healthcare interaction. You have every right to expect medical care that treats you as a whole person, not just a collection of symptoms or a birth date written on a chart. And if you ever feel overlooked or dismissed, that is not a reason to give up. It is a signal to speak up. Seek a second opinion. Ask for clarity. Or find a healthcare provider who values you as the unique individual you are. From what I have seen, the best outcomes in medicine come when patients and doctors work together as a team. That means being open about your worries, asking for explanations when something feels unclear, and remembering that you play an active role in your care. You are not a passive bystander. You are a partner in your own health journey. When you approach your appointments with this mindset, you are far more likely to receive the respect, attention, and thorough care you deserve. So as you move forward, keep this knowledge close. Let it guide you towards stronger, more respectful relationships with the professionals who care for your health. And never forget, your life, your story, and your well-being matter just as much today as they did decades ago. We would love to hear from you. Share in the comments one insight you gained today and how you plan to use it. Your reflections mean a lot to us and give us encouragement to continue creating content that informs and inspires. If this message resonated with you, please like this video, subscribe, and turn on the notification bell so you never miss what comes next. Thank you for being here, and we look forward to seeing you again soon.